Hey everybody, Luke Gordon, physical therapist here, and today's video is about total knee replacement surgery and specifically about pain medications taken after surgery. So there's a few different questions I get a lot from people who are taking pain medications after surgery. Typically these are narcotic pain medications, and a lot of times people are wondering things like, should I take them? How often should I take them, especially first after surgery? How long am I going to take them for? Is it going to be several weeks or months? And they're worried about maybe being on those medications for too long. So I want to talk about pain medications after surgery, just in general, and then address some of those specific questions. And then I also want to talk to you about once in a while, we get a client who is very nauseous right after surgery with their pain medications and what you should do if you're in that position too. So let's start off just kind of what I mentioned. Well, first is, should you take them? How often should you take them? And my first piece of advice for you when it comes to your medications after surgery is take them as prescribed. Typically your doctor is going to say, take this hydrocodone or whatever it is, the narcotic pain medication every 4 hours or every 6 hours. And my best advice to you early on, especially if you're not having any adverse reactions to the medication, is take them as prescribed. The big thing I want you to understand at this stage in the recovery is that your knee has gone through a serious amount of trauma. There's a lot of pain. There's a lot of swelling, as you probably already know if you've had surgery already. And what you want to do right now is you want to stay ahead of the pain. It's a huge thing. So even when you're feeling really good in your first week or 2 or 3, which hopefully you do, because not everyone does, but hopefully you do, keep taking those pain medications as prescribed until your doctor tells you to start weaning off of them. A common mistake I see people make is they're feeling really good, their motion's good, their swelling's pretty well under control, and now they're starting to skip doses of their pain medication. And what happens potentially if you do that is all of a sudden your pain comes back, and it comes back really quickly. And now you're kind of in a hole, and you have to dig yourself back out of it. So stay ahead of the pain, especially in those first several weeks until your doctor tells you to wean off of it. Of course, you can ask your therapist as well, but that's a big one. So just stay ahead of the pain, take them as prescribed, because then you're going to be able to do your stretches and your exercises and get that knee range of motion as quickly as possible. So take them as prescribed, stay ahead of the pain. Second thing then is I get people who are worried about, well, I don't want to take them for too long because I don't want to get dependent on narcotic painkillers, or I don't want to get addicted, essentially is what they're saying. I don't want to get addicted to pain medications. And knock on wood, I've never seen a client get addicted to pain medications after total knee surgery. It's not chronic pain. We're not talking about taking these things for 6 months to a year. It's usually within the first month or so that you're going to get off of them. And typically, people have no difficulty getting off of them. Now, understandably, if you have a history of substance abuse or issues with dependency or addiction, that's something to take into account. But for the average person who doesn't have any of those factors working against them or just in their history, it's not usually going to be a concern. So again, you're going to get off the pain medications usually within about a month or so. So just take them as prescribed until you're ready to wean off of them. And then when you're ready, it shouldn't be a big deal. So don't get too worried again about being stuck on pain medications for the rest of your life or getting addicted or getting dependent. It's really not that common. And again, a total knee is not chronic pain, such as a chronic back pain or a chronic sciatic nerve pain. And with those situations, you definitely are at much higher risk of getting, dependent on them more so than addicted, just because you feel really icky if you get off of them. So that's my second piece of advice. Third thing then is once in a while, I'll have a client show up in the PT clinic a day or two after surgery, and they look awful. Their color is horrible. You can tell they just feel gross. Usually they look kind of green, and they have a total knee replacement, but it's not really their concern at that point. Yeah, the knee hurts, but they just feel awful. So for those folks, usually what it is they're having an adverse reaction to the narcotic pain medication. If that's you, or if you're preparing for surgery and you just want to keep this in the back of your mind, if you seem to be struggling with the pain medication, talk to your doctor immediately. Most likely they're going to want to stop your medication and switch you to something different that shouldn't make you so nauseous. And the reason I bring this point up is because if that's you, it's really hard to work on your rehab and your stretches when you feel that gross and you feel that bad. So again, if that's you, or if that's your spouse or a loved one, just get on top of that as quickly as possible. Talk to your doctor, call the nurse, tell them how you're feeling, and more than likely they'll give you some advice about getting off of those medications and possibly switching to some other ones that will at least make your rehab, more tolerable and comfortable. So those, again, are the questions I usually get about pain medications. So if you have any other questions, of course, leave it below the video, but hopefully that helped. And again, I just want to kind of ease your mind going into surgery that it's completely normal to take pain medications afterwards. You're going to want to take them. And at some point, again, around 4 weeks or so, you're probably going to wean off of them anyways. And for most people, it's not a big deal. You wean off of them when you're ready, your knee is doing good, and you're happy that way. So anyhow, keep going. Oh, one last thing I want to mention. It's really important to keep on your pain medications at night too, because sleep is really important. So try to just keep that in mind too. Get as much sleep as you can, get as much rest as you can. So there you go. Thank you for watching. Please like it and subscribe before you go. I appreciate that. Leave me a positive comment if you feel like saying something nice to me. And I'll be back again soon with some more videos on total knees and shoulders and backs and sciatica and anything else you can think of. So that's it. Thanks for watching.